antiretroviral drugs can be kind of hard to remember, but if you master them, they can be easy points to score on your exam. So let's focus on mastering these skills using incredible mnemonics, quiz, and several high-yield associations. So be sure to watch this video until the end. So there are 4 main groups of antiretrovirals. These include protease inhibitors, integrase inhibitors, NRTIs, and NRTIs. So how can we know which drugs belong to which groups? Well, for protease inhibitors, they have Navir in their names. So protease inhibitors, Navir. Navir, protease inhibitors. Okay, integrase inhibitors, that's a bit easier because integrase, the trigger, is in most of the drug names as well. So integrase inhibitors, Tigger. And NNRTIs have Vir. NNRTI, Vir. NRTIs have Dean, Bean, Seen. Dean, Bean, Seen. So just take a quick look at this and try to remember them, because in the very next slide, I'll be testing how much you have remembered. Indinavir. So it has Navir. What group does that belong to? And that is protease inhibitors. So remember, Navir, protease inhibitors. Protease inhibitors, Navir. Okay, next. Raltegravir. So that has the Tigger in it. So what group does it belong to? This is an easier one, and that is integrase inhibitors. Okay, now on to number 3. Nevirapine. It has Vir. So that is NNRTIs. Okay, so Vir, NNRTI. Lastly, didanosine. It has seen. So what is that? It's a NRTI. So remember, Navir, protease inhibitors, the Tigger, integrase inhibitors, Vir, NNRTIs, and Dean, Bean, Seen, NRTIs. Okay, so here we're just emphasizing that protease inhibitors have Navir in their names. So protease inhibitors, Navir, like atazanavir, darunavir, indinavir, lopinavir. Okay, so protease inhibitors, Navir. So what is the mechanism of action of protease inhibitors? Well, these include the inhibition of the pol gene and the prevention of maturation. You can remember this with the 3 P's that are highlighted here. So protease inhibitors inhibit pol genes and prevents maturation. So PPP. And remember, protease inhibitors, Navir. So we know that protease inhibitors, their drugs have Navir. We know the 3 P's of how they work. Now, what are the complications or side effects of protease inhibitors? So these include the HIL. So what is the HIL? Hyperglycemia, GI intolerance, and lipodystrophy. So we can remember protease inhibitors' side effects with HIL. We can now summarize every single thing that we've learned so far about protease inhibitors with this one line. P never goes uphill, or P never goes uphill, okay? So the P stands for, of course, protease inhibitors, the pole gene which is inhibited, and the prevention of maturation. So that P lets us know the mechanism of action and what drug class we're talking about. Navier lets us know that the drugs have this in their names. And the hill, of course, represents the complications or side effects, which include hyperglycemia, GI intolerance, and lipodystrophy. So remember, P never goes uphill. So okay, we know that P never goes uphill and what that stands for. But if you want to score some bonus points on your exam, then here are some additional side effects. And that includes indinavir. So the side effect for that is nephrolithiasis. And ritonavir. The side effect for that is liver disease. So you can just take a mental note of this so you can have some additional facts about protease inhibitors. So you'll be seeing this slide a lot during the course of this video because my aim is to emphasize everything about antiretrovirals with mnemonics, quizzes, and of course repetition. So for protease inhibitors, P never goes uphill. The P stands for protease inhibitors, inhibition of the pole gene, and prevention of maturation. Navier lets us know that these drugs have Navier in their names. And HIL stands for the side effects of protease inhibitors. These include hyperglycemia, GI intolerance, and lipodystrophy. Now that we're masters at protease inhibitors, let's move on to NRTIs. So these are the antiretrovirals that have Dean being seen. NRTI, Dean being seen. These include drugs like lamivudine and zidovudine. So Dean being seen, NRTIs. But you probably noticed that there are two drugs here that don't have the Dean being seen. So you have to remember these and know them well, because these are drugs that examiners like to emphasize because they're different from the Dean being seen rule. So these exceptions include abacavir and tenofovir. Abacavir, tenofovir. So let's take a good look at this slide. NRTIs, Dean being seen, except abacavir and tenofovir. So I've been saying NRTIs a lot, but what does that stand for? It stands for nucleoside reverse transcriptase inhibitors. So the name of these drugs tells us what the mechanism of action is, and that is to competitively inhibit nucleoside binding to reverse transcriptase. And remember, NRTIs are the Dean being seens, except for tenofovir and abacavir. We should also note that NRTIs need thymidine kinase to be activated. So remember, NRTIs, Dean being seen, except abacavir and tenofovir. So there are other two key points I want you to pay attention to, and that is tenofovir does not need thymidine kinase to be activated. So that is extremely important to remember. How I remembered are the two T's, T for tenofovir and T for thymidine. So tenofovir does not need the thymidine. Another important fact is that zidovudine is given to neonates born to HIV positive mothers. Side effects of NRTIs can be remembered by the mnemonic B-RAMP. And that is B-RAMP. It stands for B, bone marrow suppression, R, rash, A, lactic acidosis, M, megaloblastic anemia, and P, peripheral neuropathy, and another P, pancreatitis. So, zidovudine is more commonly associated with the side effects of megaloblastic anemia. And for the two P's, these are side effects caused by didanosine. And now back to our favorite squares, or kinda squares. And that is to review NRTIs. So remember, NRTIs have the Dean Bean scene, except abacavir and tenofovir. Also, remember that tenofovir does not need thymidine kinase to be activated. So the two T's don't need each other, basically. So the side effects can be remembered with B, ramp. B, bone marrow suppression. R, rash. A, lactic acidosis. M, megaloblastic anemia, which is more commonly associated with zidovudine. P, pancreatitis. And P, peripheral neuropathy. And these two P's are most likely seen in patients taking didanosine. Now ask yourself, do you remember what P never goes uphill means? P, protease inhibitors. P, inhibition of polygene. Third P, prevention of maturation. And Navier. Drugs with Navier are protease inhibitors. And HIL stands for the complications: hyperglycemia, GI intolerance, and lipodystrophy. So now we know protease inhibitors, we know NRTIs. Let's continue. Integrase inhibitors. So these have the tigger in it. So raltegravir, elvitegravir, dolutegravir. So these are integrase inhibitors, and it's easier to remember because the TEGR are in the drug names and for the class of drugs. So again, their name kind of tells us what they do. So they reversibly inhibit HIV integrase, which inhibits HIV from integrating into the host cell. So integrase inhibitors prevent HIV from integrating into the host cell. So the main side effect of integrase inhibitors is hypercholesterolemia. So this group is pretty easy to remember because integrase inhibitors, the drugs have trigger in it, and also the name integrase inhibitors lets you know that it prevents HIV from integrating into the host cell. And it also just has one side effect, and that's hypercholesterolemia. And congrats, you did it. You've mastered 3 drugs. So 3 squares are complete. We have P never goes uphill. Then we have the NRTIs that include the Dean Bean scene, except abacavir and tenofovir. And the two T's don't need each other, so tenofovir does not need thymidine kinase. And of course, the side effects of NRTIs, B ramp. And finally, integrase inhibitors, which is a bit easier to remember. These drugs have TIGR, and their only complication or major side effect is hypercholesterolemia. And we're on to our final group, and these are the NNRTIs. The NNRTIs have VER, and NRTI. NNRTI, VER, never. Okay, so these include drugs like delaverdine, efavirenz, and nevirapine. So we can remember the mechanism of action again by using their names. So NNRTI stands for non-nucleoside reverse transcriptase inhibitors. So these drugs are kind of similar to the NRTIs in their mechanism of action, except the fact that they just bind at a different site. Also, they do not need thymidine kinase. So remember, NRTIs. So it's kind of like NN, no need. No need for thymidine kinase, okay? So the major side effects for NNRTIs are that they are teratogens and you can have vivid dreams. So NN, no need. So no need for thymidine kinase. And we can also say night night to remember that the NNRTIs cause vivid dreams. And all the squares are complete. So let's review everything that we have learned. Protease inhibitors, we can remember this by saying P never goes uphill. P for protease inhibitors, inhibition of the pol gene, and prevention of maturation goes uphill. Hill stands for the side effects, hyperglycemia, GI intolerance, and lipodystrophy. And then we have NRTIs. These drugs include NBME. These drugs need thymidine kinase to be activated, with the exception of tenofovir. So like I previously said, NRTIs have NBME except for abacavir and tenofovir, and the two T's don't need each other. And for the complications of NRTIs with B-RAMP, bone marrow suppression, rash, lactic acidosis, megaloblastic anemia, mainly with zidovudine, and P for pancreatitis and P for peripheral neuropathy. Then we have the easier group, the integrase inhibitors, where their names literally tell us what they do. Integrase inhibitors, they inhibit the HIV virus from being integrated into host cells. Also, they all have the Tigger in their drug names. And the one and only main complication that they have, well, that is commonly tested, is hypercholesterolemia. And finally, we have the NNRTIs, or the no-need drugs, or the night-night drugs. So NNRTIs have no need for thymidine kinase, and they are night-night drugs. They cause vivid dreams, and they are also teratogens. These NNRTIs have the ver sound. So if you want, you can pause the video here and kind of recite everything I just said to yourself to really solidify all of these key points, and they will help you score major points on exam day. And now we are going to move on to a very high yield section to quiz your knowledge and some extremely high yield associations. Let's go to question 1. An HIV positive male presents to the clinic for his checkup. He has no complaints. His CD4 count is 840. Blood work reveals cholesterol level of 350. What is the mechanism of action of the antiretroviral that caused this finding? So this patient is HIV positive, presumably taking antiretrovirals, and presents with hypercholesterolemia. So what drug caused hypercholesterolemia? Those are the integrase inhibitors. So let's try to find which option is that. Option A inhibits the pol gene. So this is protease inhibitors, because remember the 3 P's? Protease inhibitors, inhibition of the pol gene, and prevention of maturation. So option A is not it. Option B inhibits nucleoside binding. So this could be either NRTIs or NNRTIs. And hypercholesterolemia is not a common complication for this, so that's not the answer. Option C inhibits HIV integration into the host cell. And yes, we have a winner. The answer is option C. So let's look at our favorite four squares here. So if you really have these four squares down packed, then you would most definitely get this question correct. Now let's move on to question 2. A neonate was born to an HIV positive mother. What drug should be administered? So this is a one-step question. Either you know it or you don't. But you do know it because we went through it together. So the answer is option B, cytopheidine. So cytopheidine is an NRTI that is given to neonates born to an HIV positive mother. Remember, NRTIs have the dean, bean, seen, except abacavir and tenofovir. And remember, the two T's don't need each other, so tenofovir does not need thymidine kinase to be activated, and also NRTIs have the complications BRAMP. Question 3. A 27-year-old was recently diagnosed with HIV. Which of the following drugs would be best for her? So this question requires us to know that HIV patients are usually treated with triple therapy, which includes 2 NRTIs and another group. So let's look for that option. So remember, NRTIs have dean, bean, seen, except abacavir and tenofovir. So we're looking for an option with 2 of those and another group, okay? So option A. Option A has 2 NRTIs and a protease inhibitor. So this is not it. Remember that the NRTIs have VER and the protease inhibitors have NAVIR. So option B. This includes 2 protease inhibitors, lopinavir and raltegravir, and 1 NRTI. So option B is not it. Option C. Ritonavir, abacavir, nevirapine. Nope. Because this is an NRTI, an NNRTI, and a protease inhibitor. So that's not it either. Option D. Indinavir, lamivudine, and didanosine. So as you can see, it has a dean and a seen and a navir. So that's 2 NRTIs and a protease inhibitor. So the best answer here is option D. Okay, so this is part 2 of this question, okay? So 6 months into this drug regimen, she develops epigastric pain, elevated amylase, and lipase. What drug most likely caused the development of these symptoms? So this question is trying to describe pancreatitis. And let's recall BRAMP side effects of NRTIs. So the last P's, pancreatitis and peripheral neuropathy, are usually caused by the drug didanosine. So the answer here is option C. And this is part 3 of this question. What other side effect may she develop? So we identified that didanosine was causing some pancreatitis. So what else may happen? Let's look at the options. A, hypercholesterolemia. B, peripheral neuropathy. C, hyperglycemia. Or D, metabolic syndrome. And B, ramp from the 2 P's, and that is peripheral neuropathy. So remember, B ramp, bone marrow suppression, rash, lactic acidosis, megaloblastic anemia, peripheral neuropathy, and pancreatitis. A man was started on an antiretroviral that requires thymidine kinase to inhibit nucleoside binding. Which of the following was the man given? So this drug needs thymidine kinase to be activated. So he most likely was given an NRTI. NRTI. So these drugs need thymidine kinase. NRTIs are the dean being seen with the exception of tenofovir and abacavir. But tenofovir and abacavir are in the options for this question. So what is the answer? Well, remember, the two T's don't need each other. So tenofovir does not need thymidine kinase to be activated. So the answer is E, abacavir. A patient on antiretrovirals starts to have vivid dreams. What group does the medication that causes this most likely belong to? A. Integrase inhibitors. B. Nucleoside reverse transcriptase. C. Protease inhibitors. Or D. Non-nucleoside reverse inhibitors. So if you remember NN, no need, NN, night, night, then you would easily find out that the answer is option D. Remember, non-nucleoside reverse transcriptase, NNRTIs, NN, no need for thymidine kinase, and NN, night, night, because their most common side effects are vivid dreams and they are teratogenic. So option D is the best answer choice here. Now on to our final question. A 44-year-old man presents due to a change in his body habitus. Exam reveals loss of adipose tissue on his extremities and face, with a noticeable increase in abdominal girth. What medications most likely cause these symptoms? A. Ritonavir. B. Diloverdine. C. Efavirenz. D. Nevirapine. So this question is describing that this patient is having some weird redistribution of fat, and this occurred in a patient most likely taking antiretrovirals, since all the options are antiretrovirals. So we have to figure out which antiretroviral can cause this weird redistribution of fat. And this can be easily recalled if you remember P. Nevir goes uphill. So we already went through the 3 P's and the Nevir. So goes uphill. What does the hill stand for? H. Hyperglycemia. I. GI intolerance. And L. Lipodystrophy. So we are looking for a Nevir. So the answer is option A. So let's review our 4 squares to solidify everything that we have learned about antiretrovirals. So protease inhibitors, P. Nevir goes uphill. The 3 P's, protease inhibitors, inhibition of the POL gene, prevention of maturation. Nevir, drugs with Nevir are protease inhibitors, and goes uphill. H. Hyperglycemia. I. GI intolerance. L. Lipodystrophy. And then we have NRTIs, which are the Dean Bean Seen drugs, with the exception of abacavir and tenofovir. And the 2 T's do not need each other. So tenofovir does not need thymidine kinase to be activated, unlike the other NRTIs. Also, the complications of NRTIs can be remembered with BRAM. B. Bone marrow suppression. R. Rash. A. Lactic acidosis. M. Megaloblastic anemia, most commonly related to zidovudine. And the 2 P's, pancreatitis and peripheral neuropathy, which is associated with didanosine. And then we have our easier group to remember, the integrase inhibitors. And their name tells us what's their mechanism of action. The integrase inhibitors inhibit the HIV virus from integrating into host cells. Integrase inhibitors also have the sugar in their names. And the main side effect of these drugs is hypercholesterolemia. And finally, we have the NRTIs. And these are the drugs with Ver. And they do not need thymidine kinase to be activated. So we can remember this with no need, NN, no need for thymidine kinase. And their side effects include that they are teratogens and they cause vivid dreams. So NN, night, vivid dreams. NN, no need for thymidine kinase. And that brings us to the end of this video. I truly hope that you enjoyed it. I put a lot of work into it to make it as easy to remember and to really be able to test your knowledge at the same time. So I hope that you can maybe remember these 4 squares in your exam and that you'll be able to score major points on exam day thanks to this video. So if you liked this content, be sure to power up the like button, hit subscribe, and that notification bell. As always, thank you for watching, and to continue learning more, click this video right here. Click it now. Okay, thank you. Bye.